April 29, 1945. The gates of Dachau fall to American soldiers somewhere in the dust outside Munich, and with them comes the first visual encounter with systematic horror. Captain Margaret Eleanor Hayes moves through the perimeter with her medical team. A registered nurse from Philadelphia with 14 years of clinical experience and a record that had earned commendation from General Patton himself. She has treated battlefield casualties across North Africa and Europe. Nothing in her training has prepared her for what walks toward her through that April dust. 382 men emerge from the medical block. Not all of them walk. Some are carried. Some are dragged by comrades whose own legs barely support their own weight. Hayes moves with purpose, her eyes cataloging, her clinical mind trying to organize the visual chaos into manageable categories. Her junior nurse, Private Betty Carmichael from Kansas, is 2 steps behind her, her face pale, her clipboard trembling. Hayes says to Carmichael without turning, "Take vitals on every ambulatory prisoner. We need baseline data. Don't ask about medical history yet. Just observe and document." Carmichael nods, understanding that structure is survival in moments like this. They enter the medical block. The smell arrives before the conscious mind can prepare for it. It is not simply the smell of unwashed human bodies or inadequate sanitation. It is something layered, something that speaks of chemical agents, blood degradation, and bodily systems pushed beyond their functional limits. Hayes has smelled death before. This smells like death that has been methodical. The wards are divided into 6 sections, each one marked with German notation. Hayes's translator, Private Emil Rothstein, moves ahead of her, his jaw clenching with each doorway. Rothstein is German himself, a refugee whose family had fled in 1938, now serving as the voice between 2 languages and 2 worlds. Rothstein reads aloud, his voice mechanical, protective, trying to maintain professional distance from the words he speaks. He says, "This section is marked Erkältungsversuche, cold experiments. This one is Druckversuche, pressure experiments. This corridor shows Injektionsversuche, injection experiments." With each notation, his hands grip the door frame a little tighter. Hayes responds, "Document everything, every marking, every piece of equipment, every file. Combat photographers are already here. We preserve the institutional record before anyone can claim it never existed." In the hallway between sections, they encounter rows of metal bathtubs. Each one is corroded at the seams, stained brown with what appears to be biological waste and something darker. One bathtub still contains water. The water is murky, discolored. A thermometer sits on the edge, its scale readable. The lowest marking visible is 20 degrees Fahrenheit. Carmichael kneels beside the tub, her hand hovering over the surface. She does not touch it. She says, "Ma'am, this one still has ice in the bottom, under the water. I can see it." Her voice is very young. Hayes places a hand on Carmichael's shoulder. She says, "Step back. Don't contaminate the scene. We take photographs. We measure temperature. We document exactly as we find it. This is evidence now. This belongs to history." They move deeper. In one ward, a prisoner sits motionless on a bench. His identification tag reads Stanislaw Morozek, age 24, though his face suggests a man in his 60s. When Hayes approaches him and lifts his shirt to assess vital signs, she sees what appears to be the entire torso mapped with precise surgical incisions. Each one is closed carefully. Each scar shows signs of deliberate internal manipulation. Some of the incisions show signs of reopening and rehealing multiple times, each cycle visible in the tissue patterns. Hayes asks him, her voice steady and low, "Stanislaw, can you tell me what procedures were done?" She asks in English first, then looks to Rothstein for translation into Polish. Stanislaw does not respond. He stares at his own chest as if it belongs to someone else entirely. His hands do not move. His eyes do not blink. It is as if consciousness itself has learned to become a liability, and survival has required that he separate from his own body. Carmichael, witnessing this, steps backward and finds herself suddenly unable to maintain professional composure. She excuses herself and walks to a corner of the ward, where she vomits into a metal bucket. No one stops her. Everyone understands that witnessing this requires the body to process it somehow. Hayes turns to Rothstein and says, "Get medical histories from anyone who can communicate. Start with the ambulatory cases. Find out what procedures were performed, when, on whom, by which doctors. Compile a list. We need names, we need dates, we need procedure descriptions. Rothstein nods and begins moving through the ward with a notebook. His conversations with prisoners are conducted in Polish, German, and a hybrid of both. The prisoners respond to him with fragments. Fragments are enough. The pattern emerges even from incomplete testimony. Within the medical administration office adjacent to the wards, Hayes and Carmichael find filing cabinets that have not been destroyed in the hasty retreat. The Germans have left everything. The records show names, dates of admission, dates of procedure, dates of death or discharge. The discharge category is consistent across multiple files. Entlassung wegen Untauglichkeit. Discharge due to unfitness. Hayes pulls one file at random. She reads aloud the contents to Carmichael. Subject number 2847. Anton Lukowicz, admitted September 12, 1944. Procedure notation. Kälteversuche, cold exposure test, 60-minute duration. Date of procedure, September 14, 1944. Outcome, severe hypothermia, core temperature recorded as 77 degrees Fahrenheit. Recovery period, 14 days. Notation of second procedure, September 30th, 1944. Same protocol. Outcome, severe hypothermia. Victim did not regain consciousness for 22 hours. Discharge notation, October 15th, 1944. Status, Entlassung wegen Untauglichkeit. Carmichael asks, "Ma'am, if he was discharged, where did he go?" "He's not in the prisoner population we're processing." Hayes does not answer immediately. She pulls the death records file. She flips through pages, running her finger down entries. She finds the notation. She says, October 16th, 1944. Anton Lukowicz. Cause of death recorded as pneumonia. Cardiac failure secondary to pneumonia. Buried in mass grave, Zone 7. She looks at Carmichael. He was discharged from the medical program. The next day he died. He never left the camp. The patterns become visible as they continue through the files. Hundreds of names. Hundreds of discharge notations. Hundreds of death records scattered across the same time periods. The mathematical impossibility of the narrative becomes clear. Men could not simultaneously be discharged as unfit and die of natural causes days later. The discharge notation was administrative camouflage. The experiments continued until death. Then they were reclassified. Soldiers and photographers have filled the administration office now. A lieutenant from Army Signal Corps is organizing the files into boxes, labeling them for shipment to a central archive facility. Hayes approaches him, her hands still holding the files. She says to the lieutenant, "These records document systematic medical procedures performed on prisoners. Procedures that appear to have resulted in death. These need to be preserved as evidence, not archived and forgotten." The lieutenant, whose name is Harrison Webb, responds with bureaucratic precision. He says, "Ma'am, my orders are to collect all German documentation for centralized processing. That's exactly what I'm doing. Everything goes to Frankfurt. Medical records go to the Judge Advocate General's office. It'll be properly handled through channels." Hayes says, "These aren't standard medical records. These are records of what appears to be human experimentation. Criminal experimentation. They need to be flagged for priority investigation." Webb places the files into a box marked with careful notation. He says, "Flag them how? I'm a signals officer. I photograph, I box, I ship. I don't interpret. The investigation side will determine priority when these reach Frankfurt. That's not my decision to make." Hayes understands that she is encountering the machinery of institutional process. It is not designed to acknowledge urgency. It is designed to disperse responsibility across so many layers that no single person bears accountability for delay or oversight. Colonel Francis Lee arrives at the medical block approximately 2 hours after the initial liberation. Lee is a career officer, West Point 1921, with medical logistics experience dating back to World War I. He moves through the wards with the calculated gaze of someone who has seen suffering before and has learned to modulate his emotional response in order to function. Hayes approaches him immediately. She has prepared her case. She carries 3 files as examples. She lays them out on the administration desk, creating a visual argument through documentation. Hayes says to Lee, "Colonel, these records indicate systematic medical procedures performed on prisoners. The procedures appear to have no therapeutic purpose. The outcomes suggest deliberate harm. Subject exposure, high-pressure chambers, injections of unknown substances, multiple procedures on the same individuals, death rates consistent with experimental protocols, not disease or malnutrition." Lee examines the files. His face remains neutral. He reads one file completely. He reads portions of another. He places them back on the desk. Lee says, "Captain Hayes, I understand what you're seeing. I'm looking at the same documentation. But what I'm also seeing is field records from a concentration camp, created under German command, potentially falsified or exaggerated by prisoners seeking to document abuse in order to seek retribution or reparation after liberation." Hayes responds, "Sir, with respect, these are German administrative files, German notation, German medical terminology, German filing systems. These are not prisoner testimony." Lee nods. He says, "Agreed. They're German records. They're also potentially incomplete, potentially falsified, potentially lacking context that only expert medical analysis could provide. We have no independent verification of what these procedures actually were. We have no medical testimony from the subjects themselves. We have no testimony from the doctors who conducted them. Without that, what we have is suspicion. Serious suspicion, but suspicion nonetheless." Hayes says, "With respect, sir, we have 382 witnesses. They're right here. They can testify about what was done to them." Lee's expression changes slightly. He says, "Captain, the liberation priorities are humanitarian. Feeding these men, getting them medical attention, processing them for return to their home countries. Those are the immediate orders. Forensic investigation of medical documentation is secondary. That will be handled through proper channels. Intelligence services, Judge Advocate General, the Army's investigation apparatus, not through field medical personnel, no matter how clinically astute." Hayes says, "Sir, if we don't document their testimony now while memory is fresh, while the physical evidence is visible, that testimony becomes less reliable over time. The marks on their bodies will fade. Their memories of what was done will become less precise." Lee picks up one of the files. He says, "Captain, I'm not disagreeing with you. I'm telling you that the priority sequence is different from what you're proposing. These records will be collected. They will be shipped to Frankfurt. They will be translated. They will be reviewed by medical experts and legal authorities. That process takes time, but it happens through proper channels. Your job is immediate medical care, not investigation, not prosecution, medical care. Can you do that?" Hayes recognizes the conversation's endpoint. The decision has been made by authority. She says, "Yes, sir. We'll focus on immediate care." Lee says, "Thank you. And Hayes, document your own observations, your clinical notes, your impressions of the physical evidence you observed. That will matter in the record. But the investigation itself goes through established channels." He leaves. The conversation ends. The machinery of institutional process continues. The files are boxed. They are labeled. They are logged. They are scheduled for transport. That night, in the barracks assigned to her medical team, Hayes writes her field notes by candlelight. She writes descriptions of the scars she observed. She writes temperatures from the thermometers. She writes the notation about discharged prisoners and their subsequent death records. She writes Stanislaw Mrozek's name and his refusal to speak about what had been done to him. She writes everything. Carmichael sits next to her, unable to sleep. She says, "Ma'am, do you think anyone will read these notes? Do you think anyone will care?" Hayes says, "I don't know, but they'll exist. They'll be part of the record. If nothing happens with them now, they exist for later, for someone else to find, for history to evaluate." Carmichael says, "That feels insufficient." Hayes says, "It is insufficient, absolutely insufficient, but it's what we can do right now. We can document. We can preserve evidence. We can refuse to pretend we didn't see what we saw. The rest is beyond our authority." She continues writing through the night, thousands of words, descriptions of procedures, names of victims, Observations about the institutional structure that had protected these experiments behind Nazi rank and bureaucratic notation. By morning, the medical files have been boxed and loaded onto transport vehicles. The boxes are marked with reference numbers but not with any notation that would signal their content to receiving personnel at Frankfurt. They are simply boxes in a warehouse logistics system. They will arrive in 6 weeks, behind other shipments, behind other priorities. The prisoners are transferred to recovery facilities. Medical treatment begins. Food is provided. Clean water is provided. Clothing is provided. The visible injuries are treated. But the testimony is not collected systematically. The names are not matched with their procedure histories. The documentation is not correlated with their physical injuries. The prisoners, traumatized beyond normal human experience, remain largely silent about what had been done to them. Stanislaw Mrozek survives the war. He lives another 37 years. He never speaks about the procedures performed on him at Dachau. When he dies in 1982, the knowledge of what was done to his body dies with him because no systematic record was made of his testimony while he was alive, and the memories were accessible. 382 survivors leave Dachau. By 1990, when a comprehensive study was conducted on the long-term medical consequences of Nazi medical experimentation, only 87 of them could be located. The remaining 295 had died or disappeared. Their medical histories, their experimental exposures, their chronic injuries were lost to documentation. The files in Frankfurt warehouse remain untranslated for 6 months. May 3, 1945, 72 hours after liberation. The recovery facility established at an evacuated German military hospital 15 kilometers from Dachau becomes the epicenter of a crisis that institutional protocol had not anticipated. Captain Hayes is now managing the medical care of 214 prisoners who are stable enough for transfer. The remaining 168 are still at Dachau itself, undergoing immediate stabilization. The mathematics of trauma has not been distributed evenly. The damage has been concentrated. The consequences are accumulating. Carmichael enters Hayes's administrative tent at 400 hours. She has not slept. Her uniform is stained with what appears to be blood and bodily fluids. Her face carries the expression of someone who has witnessed something that consciousness cannot yet process into narrative form. Carmichael says, "Ma'am, you need to come to Ward 4 immediately. We have a situation with one of the prisoners. His name is Jakob Horowitz. He's one of the cold exposure subjects." Hayes sets down her documentation and follows. The tent structure is barely adequate for the volume of patients. The bunks are arranged in rows. The sanitary conditions are being maintained as well as field circumstances allow. But the reality of mass casualty medicine in a forward area is that care is triage. And triage means that some wounds receive attention while others wait. Jakob Horowitz occupies a cot in the corner of Ward 4. He is a man of perhaps 35, though trauma has aged him into a different temporal category. His medical chart indicates that he underwent 6 cold exposure procedures during his detention at Dachau. The notation in the German records showed that his core temperature had been deliberately reduced to 81 degrees Fahrenheit on 2 separate occasions. The protocol was to maintain that temperature for 30 minutes, then allow gradual rewarming. The duration and temperature combination corresponds to historical research on hypothermia induction, a line of experimentation that medical literature would later identify as designed to gather data on human cold tolerance for military applications. Horowitz's physical presentation when admitted to the recovery facility had been relatively stable. Malnutrition consistent with concentration camp imprisonment. Scars from surgical incisions typical of the experimental block. No acute trauma, but stable. Now, as Hayes approaches, she observes Horowitz in a state of acute psychological crisis. He is not physically injured, he is not in acute medical distress, but he is exhibiting signs of severe dissociation. His eyes are open. His breathing is controlled, but he appears to be absent from his own body. His hands are clenched so tightly that his fingernails are drawing blood from his palms. His jaw is locked. When Hayes approaches, he does not appear to see her. Hayes examines him. She checks pulse. 118 beats per minute. Blood pressure 162/98. Breathing shallow. Pupils dilated. All physiological markers of acute anxiety or psychological crisis. Hayes says to him, Jakob, I'm Captain Hayes. Can you hear me? She uses German, spoken carefully. Horowitz does not respond. His eyes continue staring at a fixed point approximately 18 inches beyond Hayes's face. Carmichael says, "He was stable this morning. We brought him fresh water, fed him. He seemed to be recovering. But about an hour ago, one of the other prisoners, a man named David, he was bringing him a meal. David set the bowl down and accidentally splashed cold water on his arm. Just splashed. Jacob he broke. He started screaming. He couldn't stop. Hayes understands immediately. The stimulus is not accidental. The stimulus is connected. Cold water. The association with the experimental protocol is immediate and overwhelming. The neurons that Horowitz's brain has trained to recognize cold as a signal of danger, a signal of deliberate harm, a signal of institutional violation, have been activated again. His nervous system has no mechanism to distinguish between accidental cold water and deliberately induced hypothermia. Hayes says to Carmichael, "Get me morphine, 50 milligrams. We need to interrupt this psychological state before it causes physical harm." But as she speaks, Horowitz's body shifts. His eyes move for the first time. They focus on Hayes. He speaks, his voice barely above a whisper in German-accented Polish that requires Rothstein to translate. But the words are clear enough that emotion carries meaning before language does. Horowitz says, "They're doing it again. The water, it's happening again. They're putting me back in the water. They're measuring the temperature. I can feel it dropping. I can feel the moment when breathing becomes impossible, when the cold reaches the place where thinking happens. When I stop being myself and become only a measurement, a number, a data point." Hayes does not contradict him. She does not attempt to reassure him that he is safe, that the water is not cold, that the procedures are not happening again. All of those statements are logically accurate. None of them are emotionally true to his lived experience in this moment. Instead, Hayes sits beside him. She places her hand gently on his shoulder, maintaining contact but not restraining him. She says, "Jakob, I'm here. You're at a field hospital. You're not in Dachau. You're not in an experiment. But I understand that your body remembers what happened. I'm going to give you something to help your nervous system calm down. It won't take away the memory, but it will help your body stop experiencing the memory as present threat." She administers the morphine. Horowitz's breathing gradually slows. His pupils contract slightly. The acute crisis de-escalates. Within 15 minutes, he is asleep. His hands unclench. The blood from his palms is washed away by Carmichael. But the incident has created a secondary crisis that institutional process cannot contain. The other prisoners in Ward 4 have witnessed Horowitz's breakdown. They have seen the response. They understand that their own experiences, their own trauma, their own memories are medically significant and potentially observable by the American medical staff. That night, the manifestations begin. They are subtle at first. A prisoner named Grigor displays sudden confusion and inability to speak coherently. Another prisoner, identified as Pavel, begins trembling uncontrollably when offered a shower, apparently connecting water exposure with the cold experiments. A third prisoner, named Maxim, develops what appears to be acute cardiac arrhythmia when startled by sudden noise, his system responding to what had been conditioned as warning signals during experimentation. By morning, Hayes's medical tent is treating what she recognizes as a cascade of trauma responses. These are not new medical conditions. These are not signs of physical deterioration. These are manifestations of psychological trauma that the prisoner's nervous systems have encoded with absolute physiological credibility. Hayes sits in her tent with Carmichael and Rothstein at 0600 hours, reviewing what has occurred. The casualty count for Dachau is no longer simply the visible injuries. The casualties are now including psychological injury. The experiments have encoded instructions into the prisoner's nervous systems. Instructions to fear. Instructions to dissociate. Instructions to perceive threat, where threat no longer exists. Hayes says to them, "The German medical records documented the procedures. They documented temperatures and durations and outcomes. But they didn't document what living with the memory of those procedures does to a person. They didn't document the long-term neurological consequences. They didn't document that a man could be completely physically stable and still be in acute crisis because cold water triggered a conditioned response. Rothstein says, the investigators in Frankfurt won't understand that. They'll read temperatures and durations and see it as data. They won't see what we're seeing now. They won't see what happens when the human nervous system is weaponized against itself. Hayes says, then we document it. We document what we're observing. We document that these men are not recovering from injury. They're living with institutionalized psychological damage that the experiments encoded into their nervous systems. She begins a new form of documentation, not clinical observation of wounds and vital signs. Observation of psychological response. Observation of trauma manifestation. She documents how many times Horowitz requires sedation because of conditioned responses to temperature. She documents how many prisoners develop symptoms consistent with what would later be recognized as post-traumatic stress disorder, but for which 1945 medicine had no diagnostic category. She documents the mathematics of psychological damage. By May 10th, 2 weeks after liberation, 134 of the 214 stable prisoners have presented with significant psychological symptoms. The manifestations are diverse: acute anxiety, dissociation, panic attacks triggered by specific stimuli, nightmares so severe that prisoners are screaming audibly during sleep, cardiac symptoms, difficulty maintaining emotional regulation. Hayes calls a meeting with the medical officer assigned as her superior, Major Stephen Caldwell. Caldwell is a career medical officer, 52 years old, with field experience but limited exposure to the medical consequences of systematic torture. Caldwell arrives at Hayes's tent with the demeanor of someone expecting a routine administrative meeting. Hayes presents her data. She shows him the documentation she has compiled. She shows him the correlation between the experimental procedures recorded in the German files and the psychological symptoms manifesting in the survivor population. She shows him the pattern: cold exposure experiments corresponding with acute panic in response to water, pressure chamber experiments corresponding with acute anxiety in response to confined spaces, injection experiments corresponding with acute fear in response to medical examination. Caldwell listens. He examines the data. He says, "Captain, this is significant observation, but I need to be clear about scope. These men are prisoners of war in a field hospital. Their emotional trauma is understandable given their experience. But what you're documenting appears to be psychological instability that may require longer-term psychiatric intervention than we can provide in a forward area." Hayes says, "Sir, I'm not documenting psychological instability. I'm documenting conditioned responses." The German experiments weren't just about collecting data on physical tolerances. They were about systematically damaging the human nervous system. And that damage is still active. It's still functional. It's still causing acute physiological crisis. Caldwell says, "What are you recommending?" Hayes says, "I'm recommending that we establish specific protocols for managing their psychological responses. I'm recommending that we document the connection between the experimental procedures and the psychological manifestations. I'm recommending that when these men are transferred to POW camps or returned to their home countries, that documentation travels with them, so their own medical systems understand what has been done to them." Caldwell nods. He says, "That's reasonable, and I'll include that in my report. But Hayes, I want to be clear about something. The investigation of the Nazi medical program is not our responsibility. That's Judge Advocate General. That's intelligence services. Our responsibility is medical care. If documenting the psychological consequences of the experiments aids in the investigation, that's a secondary benefit. But our primary mandate is to keep these men medically stable." Hayes says, "With respect, sir, the psychological damage is medical. It's not secondary, it's primary. And if we treat it as if it's just a byproduct of concentration camp experience, rather than a specific consequence of specific experiments, then we're making the same mistake that institutional process made when it boxed up the German records and shipped them to Frankfurt without translation or priority." Caldwell's expression changes. He understands that Hayes is not simply disagreeing with his assessment. She is challenging the entire institutional apparatus to recognize that what was done inside Dachau's medical block requires a response that transcends administrative categorization. Caldwell says, "What do you need?" Hayes says, I need authorization to establish a comprehensive psychological assessment protocol. I need Rothstein to conduct systematic interviews with every prisoner who underwent medical procedures. I need documentation of trauma responses to specific stimuli. I need correlation between procedure type and psychological manifestation. I need to create a complete record that can eventually be compared with the German records when those are translated. Caldwell says, "You understand that this will take significant resources and time." Hayes says, "Yes, sir, I understand. But if we don't do this now, while the memories are accessible, while the physical evidence is still observable on their bodies, that documentation is lost forever. And the investigators who will eventually examine what happened at Dachau won't have the psychological component. They'll have temperatures and procedures and death rates, but they won't have the lived experience of what those procedures actually did to human consciousness." Caldwell authorizes the protocol. Over the next 3 weeks, Rothstein conducts detailed interviews with 97 prisoners who underwent identifiable experimental procedures. Each interview is documented. Each interview correlates specific procedures with specific trauma responses. The documentation is typed on military forms. Copies are made. One set is filed with Hayes's medical records. One set is prepared for inclusion in the investigation packet that will eventually be transmitted to the Judge Advocate General's office. The interviews reveal patterns that the German records had concealed. The experimental procedures were not singular events. Many prisoners underwent multiple procedures. Some prisoners underwent the same procedure repeated 10, 15, 20 times over weeks or months. The repetition itself was part of the protocol. The experiments were designed not simply to gather data, but to systematically break down the human capacity to resist or adapt to trauma. One prisoner, named David Rosenberg, describes being placed in a pressure chamber designed to simulate altitude equivalent to 25,000 feet. The procedure lasted 4 hours. His testimony, translated by Rothstein, describes progressive loss of consciousness, hallucination, and acute panic. When the pressure was released, he spent 6 hours recovering the ability to breathe normally. The next day, the same procedure was repeated. When Rosenberg describes this, his hands shake so severely that he can barely hold the cup of water offered to him. When asked to undergo a simple medical examination involving a stethoscope placed on his chest, he experiences what appears to be an acute panic attack. His heart rate spikes to 142 beats per minute. His breathing becomes shallow. He requires sedation. Another prisoner, named Samuel Cohen, describes injection experiments. He does not know what was injected. He describes sudden onset of severe illness following the injections. He describes 5 separate injection events over a period of 2 months. Each injection resulted in acute fever, delirium, and loss of consciousness for periods ranging from 6 to 36 hours. When Hayes attempts to examine him and discovers that his arm has a visible infection consistent with bacterial inoculation, Cohen becomes severely distressed. The visible infection is treated with antibiotics that have only recently become available. But the psychological trauma of seeing medical personnel approach him with implements that might constitute another injection creates such acute distress that Cohen requires physical restraint to prevent him from harming himself. The documentation accumulates. Hayes's tent becomes an archive of psychological testimony correlating with medical procedure records. She begins to see the operational logic of the Nazi medical program with clarity that the German records alone could not convey. The experiments were not simply medical protocols. They were designed to systematize terror. They were designed to make the human body itself a vehicle of institutional control. They were designed to encode trauma so completely that even years later, specific stimuli could reproduce acute crisis. On May 28th, exactly 1 month after liberation, a prisoner named Viktor Petrov is being evaluated for transfer to a permanent POW camp. His medical condition is stable. His visible injuries are healing. His vitals are normal. But when asked to stand to have his height and weight recorded for the transfer documentation, he becomes catatonic. He simply stands, unable to move, unable to respond to verbal stimuli. Hayes approaches him and asks him in German what is happening. Victor responds with a single sentence in Russian that Rothstein translates as, "They stood us on the scale every day before the cold experiments." The scale meant it was coming. Hayes understands. The procedural sequence had created a conditioned response. Standing still on a scale was a predictor of imminent harm. His nervous system had learned that sequence. His body had learned it so completely that even the neutral stimulus of standing on a scale in a field hospital generates the same neurological response as when the stimulus predicted deliberate harm. Hayes decides in that moment to take an action that exceeds her authority. She compiles the psychological documentation she has created. She adds to it detailed descriptions of the trauma responses, the triggers, the patterns. She writes a cover letter addressing the documentation to whoever will receive it at the Judge Advocate General's office. She writes it with the assumption that the German records will eventually be translated and compared with this testimony. She writes, "The attached documentation describes the psychological consequences of the systematic medical experimentation conducted at Dachau concentration camp. The experiments recorded in the German administrative files are confirmed by survivor testimony, but the testimony also reveals that the purpose of the experiments extended beyond data collection. The procedures were designed to encode trauma responses at the neurological level. Long-term consequences include complex psychological conditioning that manifests as acute physiological responses to specific stimuli associated with the procedures. No standard medical classification exists for this category of injury. No standard treatment exists. But the injury is real. It is documented. It is observable. It is measurable. Without understanding and acknowledging this category of harm, the investigation of these crimes will be incomplete." She signs it. She dates it May 28, 1945. She makes copies. She sends copies through official channels. She keeps copies in her personal records, knowing that institutional process moves slowly, and that documentation kept privately at least survives if it is lost in bureaucratic channels. That same evening, as Hayes is completing her documentation, Carmichael enters the tent with Victor Petrov. Petrov has stabilized enough to communicate. Carmichael says, "Ma'am, Victor wanted to talk to you. He says there's something important about the doctors." Victor speaks slowly through Rothstein's translation. He says, "The head doctor at Dachau was named Dr. Sigmund Rascher. The German records say his name, but they don't say what he was really doing. He wasn't studying cold resistance for military purposes. He was studying how to kill people slowly while keeping them conscious. He was studying the mathematics of death. The temperatures we were exposed to, the duration of the exposures, the method of rewarming, all of it was calculated. He was documenting the point at which the human body loses the will to survive, but before it loses the capacity to suffer. That's what he was measuring. Not cold tolerance, suffering tolerance." Hayes receives this testimony. She documents it. She understands that the German records are incomplete because they were never meant to be complete. They were meant to be institutional camouflage. They documented procedures as if they were scientific investigation. But the testimony from survivors reveals the actual purpose. Systematic creation of suffering calibrated to maximize damage while maintaining enough survival to repeat the process. The mathematics of death becomes visible only through the convergence of multiple sources. The German records providing procedural data, the survivor testimony providing experiential reality, and the psychological documentation providing neurological consequence. By the end of May, the institutional dismissal that Colonel Lee had pronounced weeks earlier has begun to crack. Hayes has created a comprehensive alternative record that correlates all three sources. The investigation cannot be dismissed now as merely suspicion or speculation. It has been documented. It has been institutionalized within American medical records. It exists in multiple copies. It has been transmitted through official channels. It has been filed in personal records where it cannot be lost. But something else has happened that institutional process had not anticipated. The prisoners themselves have become agents of testimony. They have begun to speak. The silence that had characterized the early weeks of liberation has been broken not through interrogation or investigation, but through the recognition by the American nurses that bearing witness to their testimony was itself a form of medical care. June 15, 1945. Frankfurt Warehouse. Major James Alexander of the Judge Advocate General's office stands before 847 boxes of German medical documentation. Alexander is 41, trained as a lawyer, with a mandate to catalog and determine significance of captured records. The boxes from Dachau Medical Block number 119. They sit largely unopened in the warehouse. Alexander opens the first Dachau box. Inside are hundreds of folders, each one marked with notation. Versuchs person followed by number. Experimental subject followed by number. The first folder documents Anton Lukowich, the same subject Captain Hayes had examined weeks earlier. The documentation is precise. Dates of admission, procedure descriptions, temperature measurements, outcome recordings, and discharge notation followed by death notation within 24 hours. He pulls another folder. Subject 3156. Same pattern, another folder. Same pattern again. The procedures are documented. The deaths are classified as discharge followed by natural mortality. Alexander recognizes what he is observing. This is not documentation of treatment. This is documentation of systematic harm disguised as procedure. He turns to his translator, Dr. Hans Stein, a German Jewish refugee who fled in 1937. Alexander says, "Dr. Stein, how many folders are in this box?" Stein counts carefully. He says, "Approximately 385 individual case files." Alexander says, "And the total boxes from Dachau?" Stein says, 119 boxes. If each contains similar numbers, we are examining documentation of approximately 45,000 procedures, reflecting 10 to 15,000 distinct subjects, many undergoing multiple procedures. Alexander feels the weight of numbers. He says, "Arrange these boxes by procedure type. Separate cold exposure from pressure experiments from injections from surgical procedures. We need taxonomy before we can determine crime." Over 3 weeks, Alexander's team works methodically. They open boxes, they read files, they categorize, they cross-reference subjects appearing multiple times. The pattern becomes clear and systematic. Cold exposure, pressure chamber, injection protocols, surgical procedures, pharmaceutical experiments, each category documented with meticulous German bureaucratic precision. Then, in early August, Alexander receives communication from Captain Hayes. She sends copies of her psychological assessment protocols. She sends the detailed interviews she conducted. She sends her analysis correlating experimental procedures with trauma manifestations. Alexander reads Hayes' documentation and immediately understands what has been missing. He says to Dr. Stein, "This is the critical component. The German records document procedures. Your assessments document purpose. They prove these experiments were not about data. They were about systematically destroying human psychological stability." He responds to Hayes directly. He writes, "Captain Hayes, your documentation is the missing element. The procedural records show temperatures and durations. Your assessments show that the purpose extended far beyond physiological data collection. The experiments deliberately encoded trauma responses at the neurological level. You have provided evidence establishing the true character of these experiments and the deliberate nature of harm inflicted. Your work transforms this investigation from technical documentation to complete understanding of systematic cruelty." By August 15th, exactly 3.5 months after liberation, the Dachau experimentation has been fully documented. The evidentiary package is comprehensive. Procedural records, survivor testimony, psychological assessments, authorization memoranda, correspondence between experimenters and command authority. Dr. Sigmund Rascher is located in Austria on September 3rd. When confronted with documentation compiled by Alexander's team, Rascher's defensive position collapses immediately. He is shown memoranda requesting authorization to expand experiments. He is shown data revealing 87% mortality rates. He is shown correspondence describing military applications of deliberate harm. Rascher's interrogation on September 12th contains this critical exchange. Interrogator asks, "Dr. Rascher, do you deny understanding these experiments would result in death?" Rascher responds, "The experiments were designed to understand human limits. Death was possible outcome, but primary objective was data collection." Interrogator says, "You requested authorization knowing 23% of cold exposure subjects were dying. How do you reconcile this with claiming death was merely possible?" Silence. 45 seconds pass. Then Rascher says, "The research was necessary. The Reich required this information. I was following orders from Reichsführer Himmler himself. Interrogator says, the Reichsführer approved research designed to produce high likelihood of fatal outcome? Rascher says, yes. The Reichsführer approved the program. We understood that to gather data on human physiological limits, we required subjects who could be used repeatedly and replaced as necessary. Prisoners of war provided that population. Interrogator says, so you deliberately designed protocols with high mortality? Rascher says, yes, that is accurate characterization. By September 30th, the investigation is complete. The case file contains 3,000 pages. Photographic evidence, detailed procedure descriptions, outcome data, survivor testimony, psychological assessments, authorization memoranda, correspondence, interrogation records, confessions. The institutional dismissal Colonel Lee had pronounced has been entirely transcended. Suspicion has transformed into comprehensive documented evidence of systematic murder disguised as medical research. Major Alexander writes a memorandum dated October 10, 1945. He writes, the Dachau experiments represent systematic application of medical authority to deliberately inflict harm without consent. These experiments were not rogue operations by individuals without authorization. They were authorized at the highest level of Nazi command. They were designed with knowledge of lethal outcome. They were conducted on scale of thousands. The evidence is overwhelming. The responsibility is clear. Medical authority cannot be exercised without consent. Medical authority cannot be exercised for purposes of harm. Such violations constitute crime against humanity. A framework of ethical principles must be established to prevent recurrence. Voluntary participation is not merely ethical preference, but foundational principle upon which all medical research must rest. Science without humanity is cruelty disguised. Even before the doctor's trial begins, even before formal indictment, Alexander's memorandum creates intellectual foundation for what will become the Nuremberg Code. Though not yet written, though ethical framework does not yet formally exist, the investigation into Dachau has created evidentiary foundation making ethical principle not merely aspirational, but necessary. The hidden has been made visible. The coded language has been decoded. The truth has emerged from archive. Consent becomes not negotiable. Human dignity in medical research becomes universal principle, not cultural preference. Even before August 20th, 1947 formal promulgation, the Nuremberg Code exists as inevitable response to what Dachau's files revealed. The mathematics of death has finally been decoded, and the world would never again pretend it could not read the numbers.